This interview is brought to you by NTT Data. NTT Data delivers on your mission by combining superior talent and over 55 years of government expertise with a comprehensive portfolio of technologies from cloud, security, and consulting to modernization and IT solutions. We're your ideal partner for reimagining your healthcare IT. Visit nttdataservices.com.
Hi, we're here with Greg Singleton, Chief AI Officer at HHS here at HIMSS. So glad to have you and chatting with me today.
Oh, well, thank you for the invitation. Just appreciate the opportunity to come to HIMSS and talk with you all and, help engage with everyone here.
Awesome. So what are your priorities over the next year?
A number of priorities that we have, as we've seen a lot of changes in the AI space recently, we've got a lot of good guidance from the President's executive order. So, through that executive order, we see 5 priorities that we are working on. First one's on providing resources and policies for folks so they can develop and deploy AI technologies. We're looking at grants and contracts for the department so we can encourage and spur on some innovation in AI. We're looking at quality and safety, really important in the healthcare space. How do we get assurance programs or quality standards in place so we can make sure that the things we deploy, they're safe and we can trust? We're working on public education, looking at AI, how do we leverage it in the space? How can folks deploy it? What do they need to be aware of? And then evaluating and developing what we are doing inside the department. Really want to look at how we can supercharge the department's activities through AI technologies and help improve services to the American people.
Sure. Okay. Where do you see AI impacting HHS most? I guess, is there any particular areas that you're seeing any immediate impacts or something you're targeting right off the bat?
Yeah, that's a great question. It's interesting because when we look at the changes in AI, again, the past year, it's really brought to our minds, to everyone's minds, what we can do with these technologies. And in some ways, we're looking at some near-term opportunities. The technologies that can recommend the next movie for you to watch or the next song really can be deployed in the healthcare sector to make a positive impact. So we're looking at areas where we can, help advance clinical outcomes by either servicing information that, we need to bring to a clinician's attention or, obscure research information that can help treat a patient. Looking at how we can advance research and science through novel discovery methods or new modeling techniques. We really want to look at empowering the patients. So how can we help get the information to patients so they can know how to navigate and work with the healthcare system? And then really importantly, we want to see how we can address clinician burnout. There's, the amount of information and the tasks we're asking our clinicians to perform is just ever increasing. How can we use AI to take some of those mundane tasks off their plate, allow them to be fresher and more present and available to their patients?
Sure, absolutely. Taking into account the CAI role, what are some of the key components that you think that role has right now in government as it's kind of building up its AI focus?
Good question. With the advances in AI, it's brought to us and to everyone's minds the importance of getting this right for critical segments like healthcare. We are AI and technology optimists in the department, but I'd say cautious optimists. Okay. And what we see in the President's executive order is a prioritization on ensuring that when we use these technologies for good, for advancement of health, for advancement of care, that we also have the parameters and safety mechanisms and systems in place so that we know we can do it right. And it's that balance that I believe the executive order and the administration has brought to establishing the CAIO roles. So in the CAIO role for the department, we have a number of priorities that we're looking to manage and kind of balance together. One is, spurring on innovation and development. One is on improving trustworthiness and confidence. One is on, managing responsibility for the AI and working on equitability and representation. It's kind of getting to that balance point where we're saying, we have these new technologies, we have these new tools. How do we deploy them in ways that they provide advancements, but we are confident and are able to trust them as the people that they represent our American values?
Absolutely. So looking forward to here being at HIMSS and all the things that you can learn from this sector. Is there anything in particular you're looking forward to over the next year?
Yeah, a number of good things. HIMSS is a fantastic opportunity to engage with folks and have some real rich discussions with folks about how they're approaching these challenges that we face. I think some things I'm really looking at here and discussions I'm having, talking to people on the front line, the clinicians, understanding how can we engage and leverage these technologies in their care practices. Also very interested in engaging with the innovators and developers to say, where are those opportunities to move the needle in the advancement of care for our citizens. And then, also, I think the third one is really looking forward to talking to folks to understand how we as a department can be partners with the sector and industry so we can leverage kind of a whole of department, whole of sector approach to ultimately improving our options in care when we go to the doctors. I think that's what I'm most excited about here for the conference over the next year. We've talked about the executive order, a lot of activity that we are doing, a lot of priorities that we're working on to advance AI. Ultimately, we want to get to a point where we feel that these AI tools are just tools and things that we use and engage to improve our options at the doctor.
Absolutely. Okay. Well, thank you, Greg, for standing with me here at HIMSS and getting a look at just some of the things that you're focused on as this role evolves and such an important, critical part in federal government. So thank you.
Well, thank you. I appreciate the opportunity to come and talk to you and just really enjoy the opportunity to work on these challenges and advance how we are practicing American healthcare.
Awesome.